Hello, and welcome to the Physical Therapy Owners Club podcast. I'm your host, Nathan Shields, and today I'm bringing back a frequent flyer, multi-time, is that a word? Guest back on to the podcast, Dr. Dimitrios Kostopoulos, who I'm excited to bring back because I always respect his opinion, his foresight, and his vision, and especially during this time when there's so much going on and so much change occurring, love to get his opinion and his recommendations on how to handle things and ramp back up as PT owners. But first off, Dimi, thanks for coming back to the podcast. I appreciate it.
Nathan, thank you so much for having me back. And quite frankly, I have no idea what's going to be happening when we start flying again.
Of course.
And how much our frequent flyer miles are going to be able to take us. Lots of changes will be happening. As a matter of fact, I just heard yesterday that there is a possibility that Virgin Atlantic, the airline, may be going down.
Yeah,
unless there is some funding. Yeah.
Yeah, it's amazing how widespread this is affecting everybody, and it's unfortunate. Hopefully, you don't have any frequent flyer miles on Virgin Atlantic that you're trying to cash in.
No, not right now.
Right, gotcha. Cool. But, give us a little bit. We're going to talk about what you're recommending and how people can prepare to ramp it back up as we're on the road to recovery. At least it seems like the numbers are trending in that direction. But prior to that, how do you think this is going to affect the physical therapy industry specifically from your point of view? There's a lot of clinics have closed down. Yes, a lot of clinics are starting to do telehealth. But your thoughts on how it might affect our industry going forward?
Yeah. I believe that we are going to have some fundamental changes moving forward in many different industries. I know that people may not be thinking so much about that, but a lot of things will be different. Okay.
Sure.
What do I mean by that? I cannot fathom that all of us will go to a restaurant in Manhattan in a few weeks from now, and we are going to be sitting about 8 to 10 inches away from the next table. This is not going to happen.
No.
There has to be some degree of social distancing that will continue at least for a couple of years. So I do expect some fundamental changes. Let's talk about the airline industry. I cannot fathom that you are going to have somebody sitting in the middle seat like this with a person to their right and a person to their left, and all of a sudden somebody goes clearing their throat, and the whole plane jumps up in the air trying to escape of the potential coronavirus infection. Contamination. I mean, it's not gonna. We have to have some changes that will happen in the industry. In terms of physical therapy, will physical therapy in clinic services go away? Absolutely not. However, there will be modified. For example, a patient would want to know that you have implemented some degree of cleaning and sterilizing, disinfecting procedures within your facility. They would not feel very comfortable if they are extremely close to another patient in another bed next to them. They will start valuing perhaps private rooms for manual therapy instead of doing in an open gym space. So I believe we're going to have changes in terms of space, but also because this specific period of time creates opportunities of access of patients and reach of physical therapists. Those who are smart right now and they are implementing and they are investing on advanced technologies of physical therapy delivery for the future, they will be able, based on my projections, to have an 180% increase of where their business and production was before COVID-19 in about 12 months from now.
Really? And are you basing that mostly on telehealth services? I mean, what kind of delivery methods are you talking about?
I am basing it on the delivery of telehealth services in both proximity and distant location delivery,
Mm-hmm.
as well as in implementation of diagnostics.
Okay.
And I will talk about both of these things as part of my 5 mitigation
Okay. Got it.
factors, you know.
But
look,
I think it's important, considering we recognize some of those changes are taking place, but we also have to recognize that we need to then, if we haven't already, make sure that we have policy and procedures in place to disinfect, sanitize, be more or have precautions and whatnot, because a lot of it, even if you don't think the coronavirus is that serious, I mean, or infectious, whatever it is, a lot of it is about perception. I mean, it's a lot about what people perceive, and if you're not there, you're going to lose business.
absolutely. We just filmed a new commercial for our physical therapy location in Astoria, where we are going to put it on our website, YouTube, and other social media.
Great idea.
But look, now when the whole verbiage in the message and the pictures and video shots that were taken for this commercial, they all show large spaces, they show distancing, they show protective equipment, they show therapists and patients with masks, so that they can give to the audience, to the consumer, the feeling, the certainty,
yes,
that they will be protected and they can receive and you know, this is going to be a deal breaker or maker for some practices. If you have a competitor next to you that for them it's business as usual, I don't believe they'll be able to survive in this day.
It's going to be tougher for them, is for sure. But for those people who are on the edge, they're going to say, well, you know, I have kids at home, or I want to visit my elderly mother every so often. I better go to a place that's a little bit more cautious in their approach.
Absolutely. And that's how it will be.
So, you know, now's the time to get those policies and procedures together, to start planning on how you're going to approach and show that you're following some of the precautions. I love the idea of putting a video together and posting that on your website instead of just saying, yeah, we're following precautions. Pictures are better than words. So I think that's awesome. And are you using telehealth yourself in your clinic?
Yes, we do.
Gotcha.
As a matter of fact, a third of our visits right now, they are done on actually more than a third. We are about
Congrats.
37% now of our visits on telehealth. And look, my intention right now is to have, if possible, 70% of the visits on telehealth, because I know that if I manage to maintain a high telehealth ratio there, the in-house visits will only increase the moment that the
restrictions are lifted. And
exactly. Whenever the time is where economy is back up and open. I mean, we're in New York, we're ground zero, but we're expecting just about around May 15 that, you know, they open and they lift the social distancing regulations. So people will start going out and going to various offices. So we expect that at that time, we're going to have a significant influx of in-office patients. But if you maintain the telehealth up there, then you're start waging then in having an increase in your overall.
Yeah, that's a great goal, because a lot of people might be looking at telehealth as this is just a band-aid that, and when this is all over, I'll just take it off and I'll get back to brick and mortar manual services. But for people who really want to take advantage of how physical therapy is going to be done in the future and how it can um, positively affect your clinic in the future, consider, what can it do for you if people uh, their cars break down, or their kids get sick, or they get stuck at work. Well, now instead of a cancel, that can be switched over to telehealth service if you set it up appropriately, right? And so I love your intention keeping your numbers high on the telehealth side, because inevitably people are going to still walk in and get services. But not to go down that road too far, but what if there's one or two things you could share with me and the audience that you have found successful in maintaining people or providing telehealth services? Like I said, I don't want to go too far down that road because we have other things to talk about, but are there a couple things that have been successful for you?
Yeah, here are a couple of things I'm going to bring up in regards to that. And I'm going to bring this up not because we made that mistake, but because with many therapists that I see in the webinars and the town hall meetings that we do, I hear what they say. One big mistake that somebody can do is to give to their staff a platform and say, okay, you know what, this is Zoom, this is TelePT for me, this is whatever platform, go ahead now and start doing telehealth visits.
Yeah.
Without training the staff on how to do a telehealth visit.
Exactly.
So therapists then, they are at loss. And when you don't feel certainty about something, the less certain you are, the less you want to do that something.
That's
so
right.
if they are not certain, they don't want to do it, and they are not effective in converting patients from non-telehealth to telehealth. Exactly. So train your staff. A training solution for that, and I'm going to plug in Hands-On Seminars here, is a course that Hands-On Seminars has, which is a certification course in telehealth.
Oh, how
so
cool.
That's, it's only 5 hours long, and you can certify your staff on how to do it.
Oh, that's great.
It covers all special tests and everything. So that is one thing. And the second thing would be, you have to, when you implement telehealth, you have to decide based on the reimbursement that you are getting, how you are going to pay the therapist. Are you going to pay the therapist per hour of delivery? Are you going to pay the therapist based on the number of telehealth visits they do? That's something that each private practitioner have to decide. For example, in our practice, what we do is for 2 30-minute telehealth visits, we pay an hour of work equivalent.
Oh, okay. Got it. And so your therapists aren't salaried?
Well, that is, we start talking about my mitigation factors now.
I gotcha.
But I'll talk about that.
Okay, we'll address that as we start wrapping. So let's get into it. So as people are starting to get busier, as things are starting to loosen across the country in terms of restrictions and regulations, and patients start having those elective surgeries again, what are some of your recommendations to ramp your clinics back up?
Well, first of all, I have 5 specific mitigation factors that every single physical therapy practice, private practice, must be implementing right now. And the first one has to do with money. The first one is liquidity. Okay. I don't care if you have $1 million in the bank or $5 million in your business account. Apply for the PPP loan, and hopefully now, if you didn't get it, hopefully with this new package you are going to get it. But having the money there, where some portion of that money will be forgiven
Mhm.
can be forgiven. It's a no-brainer. You
Yeah.
must get that money. So tap into that, and tap also into EIDL. Uh, some people are thinking that EIDL is only $10,000. No, it is not. EIDL can be up to $2 million
Oh, wow.
based on the size of your practice at 3.75% interest rate.
Wow.
You can take an EIDL loan and you can use that money to expand your practice right now.
Wow.
Practice expansion is important. There are tremendous opportunities out there, even for other practice acquisitions. And
I was
why?
going to say at 3.75% on a commercial loan, that is crazily,
Yes.
is historically low. And could you buy real estate? Like if you wanted to buy an office space, do you know if there are restrictions in regards to that?
Well, I am not certain if EIDL specifically can be used for real estate, but SBA has specific real estate
Yeah.
loans that you can get.
Okay.
However, acquiring a practice, you can do that.
Can you
Um,
really?
and think about this. There is a projection right now from IFA, the International Franchise Association, that about 17% of the restaurants around the country will be permanently shutting down their doors.
Hmm.
That is significant.
Yeah.
That can give you an approximate idea about other practices.
Yep.
So yes, there will be physical therapy practices that will not be able to recover. So that will provide opportunities for those who have cash, for those who have liquidity, to be able to acquire these practices at a great discount.
That's true. If expansion is your goal, now is a time that people are going to be suffering. Maybe they want stability, maybe they want cash, that you can actually, from your position, if you are in such a position, to acquire other physical therapy practices and expand.
Yeah,
That
absolutely.
there's an opportunity there.
And that first mitigation strategy, cash liquidity, takes us to number two, which is controlling your expenses. And here I want to give this message, right? So look, I have heard from several people, we are going to take the PPP money and we're going to bring all these therapists back full time, and we'll have them in our practice even if they are not producing, and we'll still pay them. I believe this can create a major problem. It will create a morale problem among
Yep.
your staff. If you start paying someone where they have no production, they deliver nothing back to you, that's a criminal exchange. They are getting something for giving back nothing.
That's true.
So that can create a tremendous problem. Instead, give them specific tasks to do.
Yeah.
Give them tasks to study. Give them tasks to help with organizing your business.
Mm-hmm.
Redo your office policies and procedures and have
Yes.
them do the project.
Yes.
Create your new strategic plan. Have them do some of the work.
Mm-hmm.
Create or update your marketing plans and marketing strategies and marketing protocols and marketing final products. Have them do the work. So if you bring them back and you pay them so that this money can be forgiven from the PPP, have them produce. Once they produce, they'll feel better about it. Yep. And they'll be more vested into your business.
Couldn't agree more. I mean, honestly, especially if you as an owner are doing a ton of work watching webinars and trying to stay on top of things, if you've ever needed an assistant, now's the time to use one of those people to become your assistant, right?
Absolutely.
If you're not doing any digital marketing, man, now's the time when all of your consumers in your community are on the internet, they're on social media. Now's the time to look into digital marketing vendors. I just had Tracy Repchuk on here, and I've had Edric Zhang. It's important to look into those other things because productivity is the basis of morale, and if they aren't productive, your culture is going to shift and change. And I've seen that in some of my coaching clients. They talk about, techs that they have still on staff because they got the funding, but they're in the back office on their cell phones. And he said, these are techs that were super productive when we were busy. I mean, they kept us humming. They were great. They were ahead of everybody else. They were looking ahead to see what the providers needed next. And now with this downtime, they can't simply keep the office clean, and I have to get on them all the time. And so you have to keep them steady and busy and productive, like you talk about.
Yeah. I believe that's very important. But you see, here is the thing: the two mitigation strategies that I talked about right now, meaning liquidity, cash, and reduction of expenses, right? Those two strategies have nothing to do with production. They are strategies where you are using money, either free money because they will be forgiven, or a low interest loan. But how long a country, a nation, the planet Earth can live on borrowed money without creating new resources? Only for very limited amount of time, right? So we have to start creating again. We have to start producing. We've had look, I've through the webinars and the town hall meetings, I've talked to hundreds and hundreds of people, and here is what I'm saying at this point in time. Okay, good. We felt bad about the whole thing. Maybe we even lost a relative or a friend, or we know of somebody who did. And that was horrible. But we cannot go into a state of apathy and do nothing about it. We have to shake ourselves away from that state and move forward and really start doing things and taking action.
Well, shake off the dust, get up and start moving along. We let the emotions flow through you. Let them happen, let them pass, but come through it with a greater resolve.
Absolutely.
Right.
And I did talk, and that is our third mitigation strategy, which is telehealth. Implement telehealth right here, right now. Telehealth is here to stay. It's not going to be going away. Okay. Very soon, Medicare will be announcing that they'll pay for full telehealth for physical therapy. It makes sense. Okay. Look, the coronavirus is not going to disappear in a month or 2 or 3. There is a very large possibility that we're going to have again significant rise of incidents next winter. If we are prepared right now as a nation and as a profession to handle all this in a more efficient way and more practical way, by having, for example, Medicare pay for telehealth, the whole process will be seamless and the economy will be affected much less. So HHS and CMS are looking at these things right now. And actually in the town hall we're doing tomorrow, we're going to have the director, APTA's director of government affairs, that will speak exactly about that.
That's cool.
About Medicare. But I can tell you, it is a matter of a few weeks until Medicare will be paying full payment for telehealth for PTs. I'm very confident about that. So
we're talking here at the middle to end of April, the last part of April. So we would expect, you think something in a month, and maybe by the end of May, we'll see something like that. That would be great.
I believe before the end of May, actually way before the end of May, we're going to have some results.
That's great. Now you're having town halls really quickly. If people wanted to join in on your town halls, where would they go?
Yeah, they can go to www.savephysicaltherapy.com. That's savephysicaltherapy.com, and they can register there, and they can watch also past town hall meetings.
Gotcha.
And that's really great.
And we're talking about these mitigation strategies. You also have a website for that. I want to make sure we cover that really quickly, right?
Okay. So what we are doing is that we offer to people a free ebook if they go to fasttracktorecovery.com. That is fasttracktorecovery.com. They'll be able to get an ebook that describes all of these 5 mitigation strategies and more.
Cool. All right. Cool. So make sure we put that plug in. But yeah, sorry, I interrupted you a little bit. Your train of thought.
No. Basically, I talked about telehealth, the importance of it, and something that I mentioned it in terms of the future and the greater access, not only at a restricted locality, but a wider access. And I want to talk to you about what I mean by that.
Yeah.
Okay. All right. So the new commercial we're putting out right now, it talks about, our practice is in New York. That's our main practice in New York. We will be offering telehealth evaluation and treatments in 5 different states: New York, Florida, Maryland, Pennsylvania, and New Jersey. Okay. Why? Because in all of these 5 locations, 5 states, we have licensed therapists. And that is the requirement to have a licensed therapist, on the location and on the state where the patient is receiving the telehealth visit. And then, provided you have contracts with insurances or you create contracts, you'll be able to bill for those. So that now starts creating a very unique opportunity to offer these telehealth services across states, either in a third-party reimbursement capacity or in a cash-paid capacity.
Now, are there some states that will recognize your license as long as you simply just apply to do so? Whereas, most states might have you actually go through the whole licensure process, but are there some states that work together and allow you to just simply turn in an application?
That is correct. And there is a website. If people go to the APTA's website, they can find the states that they have this immediate reciprocity. Across the board.
Gotcha. But that's awesome. You guys have licenses in those states, and so you can provide them across borders. That's great. A business opportunity there for sure.
Yeah, absolutely. And that takes me to mitigation strategy number 4. And mitigation strategy number 4 is right here, right now, implement diagnostic testing in your practice. This is the future of physical therapy. I'm talking about implementation of musculoskeletal ultrasound and electromyography testing. These are tests that our organization, HandsOn Diagnostics, they teach you how to perform them. I mean, Nathan, you've been at this point a veteran on diagnostics. You're board certified, actually, in clinical electrophysiology. And these tests have a great patient value. They reimburse significantly more than a PT visit. And with the new program that we have, not only we make it very real to you to join, even during this very difficult time, HandsOn Diagnostics, but also for you to start performing the testing and getting reimbursed within 30 days from the moment you get your training. Look, essentially, people can join HADS at this point just with an initial payment of $5,000, and they can start learning all of this technology, implementing it, and then we work out a payment plan.
And I think that it's heading that direction anyways. You know, I'm seeing so many more and more practices providing ultrasound in their clinics, and it's an opportunity to really provide some objective data to your providers and to your patients, and show exactly how well you are performing, and if you are, well, to begin with, if you're working on the right thing, if your idea behind the diagnosis was appropriate or not. It gives you real objective data that you can use going forward to treat patients and change your treatment plans if necessary.
Yeah, absolutely. And the way you implement the diagnostics is that as part of the continuum of care, after you do your initial evaluation, for these patients who are appropriate, you perform also the EMG and or the ultrasound, and then you create a treatment plan based not only on the findings of your clinical evaluation, but based on the findings of also the objective diagnostic testing data. And you implement that not only as an in-house business, but as an outside business, okay? Yeah. So you can perform these services for various physicians' offices
on site,
and you can get paid from those. And if you don't mind, I would like to talk about a couple of the people who have been with HANS. I don't know how many of you know of Janine and Tim McClellan from Northern Physical Therapy. Before they joined HANS, they were making $85 average per PT visit. With HANS, they're making $116 a visit, and that is a 36.7% increase on what they make per visit. In a period of 12 months, they made $800,000 just from diagnostics.
Whoa.
Okay. Bart McDonald from Superior Physical Therapy, he makes, before HADS, he was making $104 a visit. With HADS, with the diagnostics, his average per visit is $137. That's a 31.7% increase. And in a period of 12 months, he made $360,000. So that's what I'm talking about. There is potential.
Yeah, exactly. And it's huge. And to talk about the effect on patient care, recent studies have shown that with the diagnostics, 60% of the plans of care have changed.
That's correct.
Significantly.
So you can have a 61% better patient management because of the proper implementation of diagnostics on the appropriate patients. I mean, there is a tremendous value. This is future for physical therapy.
That's right. That's right. So, and I think it dovetails so well into what we do as therapists already, that it's not something that's an adjunct or a niche that's totally separate from what we're doing, but rather something that really dovetails into what we're already doing and enhances our care, and in turn enhances the value that we provide to patients, and then also increases reimbursement and net profit margins.
Yeah. And look, sometimes therapists tell me, what do you think? Should I invest to put diagnostics in my practice, or I should go and open right now another new practice? So here is what I'm going to say. Those two things are very different. I would say you can actually do both. Why? When you open a new location, you still need to do marketing from the beginning. You need to pay overhead expense for the space, either lease, rent, or mortgage. You need to have the whole structure of lots of fixed expenses, that, electricity, utilities, all that stuff. But diagnostics, you implement them within your existing practice. You don't need additional or new space. You don't need more marketing. If you do, that's great. You're going to get more patients. But you use your existing patient population to actually perform the diagnostic testing. So you have an audience there, a captive audience, ready for you to give them more information about their condition and to give them more value of service.
That's right. That's right. It's cool. So, and then the last mitigation strategy?
And number 5 mitigation strategy is for those practices that they are right now in the verge to decide to either stay open, or they have closed their doors, or they have closed their doors already, or they are thinking of closing their doors because they have low patients. So here is what I'm going to tell you. Stay open for as long as you can. And modify things. Put people hourly instead of salaried. Put them part-time. If you furlough them, you go and you work in it. But keeping your doors open creates the perception from the community that you are maintaining care, you are still there, it is different when you are here open and your competitor, who is, let's say, 5 blocks away, they have shut down their doors. The public perceives that. They perceive the fact that your doors are open. You are still delivering service. And I believe that is very, very important. And yes, there might be ethical dilemmas. I'm not going to deal with those right now. But these 5 mitigation strategies, Nathan, what they are going to do is this. If a practice before COVID-19 was making, let's say, $100,000 per week, per month, or whatever, I don't care. Let's say they were making $100,000. Right now, they bring in maybe $30,000 or maybe zero some practices because of the reduction of production. Now, if you go from 0 or from 20, 30%, start climbing up back to normal, it's going to take you forever. It's going to be a very slow path to recovery. And it's possible that you may not even recover completely. But if you implement these mitigation strategies, and instead of you going down from 100 to 10 or 0, you go down maybe to 50 or 60 or 45 or something, then your recovery will be much faster, and you're going to be even able to go above and beyond where you were before. So that's what I'm talking about.
And I truly believe that those people who take advantage of this time and are intentional with the opportunity that they have before them to make serious, significant changes for the better in their clinic will see exactly that. They will thrive after this and see and look back on this as a difficult experience that that ended up being a blessing in their lives going forward, if they handle it appropriately and intentionally.
Yeah, absolutely. That's the way it is.
Yeah.
And look, I want to make sure that I also give my sincere appreciation to all of these physical therapists across the nation who have joined the PT4Heroes.com effort, and they are providing now free physical therapy services to our first responders.
Yeah, tell us about that a little bit more. Yeah, tell us a little bit more.
Yeah, so this this is really not an organization. This is just a community grassroots effort. We decided to put it together. We paid a little bit of money and we created a website, PT4Heroes.com, a commercial that gives awareness to the doctors and nurses that they can receive, and the other healthcare providers in the front lines of COVID-19, that they can receive free services, free PT services, OT services, and speech services for them and their kids, that they can receive these services from providers who are willing to do that across the nation. And we have a couple of hundred practices across all states right now that they are participating in the program. They are writing their stories. They are writing stories about the people that they treat. And it's a beautiful thing. I mean,
Hmm.
it has taken a life of its own at this point.
And if
That's
people want
great.
to join in on the effort, they just go to ptforheroes.com.
Yeah, exactly.
Oh, how cool.
Yeah, and please share your stories, share videos, put your practice up there. It's just
That's cool.
for the greater good.
Yeah, exactly. And it might go on for a while. Like you said, people are going to be dealing with this here for a few months. We're talking about business, but there are opportunities still to serve, especially the immediate communities that we're in. And with telehealth, maybe even the communities that are distant to us, and it's an opportunity for us to serve even if our immediate community is not affected.
Absolutely. But also, this grassroots effort does something else. It brings the physical therapy, occupational therapy, and speech pathology professions in the forefront, uh, in the front lines of COVID-19 by offering those services to the people, to our heroes, to the people who
Mm,
are serving right now the patients,
yeah.
and they need help.
Hmm.
So
That's right.
yeah,
Yeah.
I'm very happy about that.
Well, thank you for spearheading that and getting it going. I appreciate it. Well, anything else you want to share with us before we sign off, Dimi?
Well, sorry for the background noise. First of all, it's just
I'm
notifications I'm getting for my
sure you got
next
a ton.
meeting
There you
here.
go.
But just I want to share that if anyone is interested to find out more information about how you can learn the diagnostic testing, how you can implement it in your practice, and how you can join right now with the COVID-19 special financial deal for $5,000, go to www.hadsmeeting.com. That is HODS meeting.com, and
Okay.
schedule a discovery call,
Hmm.
or go to fasttracktorecovery.com and grab a free ebook.
That's great. Cool. Well, thank you so much for your time. Thanks so much for your efforts. I know you're putting out free webinars, town halls to guide people through how to process these loans, what to do with their money, what's happening on the regulatory side of things. You're providing a lot of content. So I highly recommend people at least follow you and see what's happening, because I know you're on the front lines of what's happening in the PT industry and are willing to share that. So thank you for the efforts and the work that you've put into it. And this PT for Heroes is a great value add to our communities. I appreciate you setting that up as well. Thank you so much.
And Nathan, thank you not only for having me again today, but in the program, but for everything that you do, and reaching out to the physical therapy community, and informing people about so many valuable things that they can be doing right now
Yeah.
to get back on their feet and really develop their practices to the next level.
Yeah.
Our best days are ahead of us.
Oh,
Okay.
definitely.
Okay. So let's
Get ready
remember.
for them.
Exactly.
All right. Well, thank you so much for your time, Dimi.
Thank you too, Nathan. Take care.